How to be intersectional on disability, gender and sexual reproductive health.
Hi, I'm Carly.
And I'm Zoe, and together we're going to be your guides on this learning journey.
What are we going to be talking about?
Well, we're going to be talking about disability,
Yes.
women,
Great.
sex,
Woohoo!
but mostly we're going to be talking about disability and intersectionality.
I'm still excited. What even is disability?
Who gets to define it?
Who is classed as disabled enough and who gets left out? What is disability?
First of all, there's no one definition of disability.
Why do we need one anyway?
Well, firstly, bureaucracy, otherwise known as the government. Every service or government department has a different criteria you have to meet to be classed as having a disability, such as the Disability Act, Centrelink, NDIS or National Disability Insurance Scheme, or the Australian Bureau of Statistics.
Then there are rights-based definitions such as Convention on the Rights of Persons with Disabilities and the Disability Discrimination Act 1992. And then there's self-identification.
This is the definition we use at Women with Disabilities Victoria.
Self-identification is when people self-identify as living with disability, e.g. physical, sensory, intellectual, cognitive, acquired brain injury, autism spectrum, chronic illness and or mental health.
The important thing to know is that all these definitions shape how we see disability and whether people see themselves as disabled or not.
People think disability looks like this.
When in reality it looks like
Me! But it's hard to capture me in a way that would look great on a toilet door.
Look, we need to get rid of the idea that disability is a tragedy.
Yes.
People still think of disability as a problem, disability as a bad thing.
Instead, we can view disability as part of human diversity.
It's part of breaking down that idea that the best and ideal person to be in society is a white, able-bodied straight guy with great hair and abs and etc. You get the picture. The world is diverse, Australia is diverse, and disability is part of that diversity.
The problem isn't the person with the disability, but the environment and attitudes of people. This also is known as the social model of disability. Disability, gender and intersectionality.
So why are we specifically talking about disabled women?
The identity disabled and woman can't be separated. The way I experience life is specifically shaped by being a disabled woman. Intersectionality acknowledges this and says, yes, you have a different experience to other people, and yes, you will experience discrimination or disadvantage in a different way to a non-disabled woman or a man with disability.
Intersectionality is a way of understanding the impact of different aspects of identity, the power, privilege, disadvantage and inequality people experience.
Examples of these intersecting identities are age, gender, sexuality, race, religion, being Aboriginal or Torres Strait Islander, migration or citizenship status, poverty or where you live.
It's about understanding the ways these identities interact and create barriers for people participating in society, and in our situation, in health services.
Women with disabilities experience higher rates of sexual violence than other women. This is an example of how gender inequality and disability inequality intersect and increase experiences of violence.
Consider this example. A woman with a disability in a city might have a doctor or nurse who completely ignores their sexual health, leading to them missing out on regular checkups like cervical screening. But they would have the option of seeing someone else.
Whereas in a rural area, this would probably not be an option.
Hit us with some fast facts so that people know what we're talking about.
Okay, well, nearly 1 in 5 Victorian women and girls have a disability.
Nearly 1 in 3 Aboriginal and Torres Strait Islander people report living with a disability in Australia.
In Australia, 45% of people with disabilities live in poverty or near poverty, a situation that has worsened in the last 20 years.
The rate of disability in Victoria's culturally and linguistically diverse population is 22%, slightly higher than that of the general population.
And women with disabilities from culturally and linguistically diverse backgrounds are less likely to report acts of violence or to access disability services.
And women with a disability are less likely to be employed than men with a disability.
So we can see from those vast facts that adding in additional identities increases the level of disadvantage that women face.
Women with disabilities have been fighting back against systems of oppression, aka people treating them like crap, for all of time.
Disability discrimination actually has a name. It's called ableism.
It's the discrimination and social prejudice against people with disabilities or who have perceived disabilities.
It also assumes that disabled people are inferior to the non-disabled.
Why do we keep finding ways to systematically oppress people?
Well, ableism actually is reinforced by wider systems and attitudes in society. Stereotypes about disability are used to justify discrimination. It's a daily experience for women with disabilities, such as seeing women with disabilities as asexual and undesirable.
This shows the crossover between sexism and ableism.
And this has reminded me of a great quote from A.J. Withers.
Another myth that is firmly upheld is that disabled people are dependent and non-disabled people are independent. No one is actually independent. This is a myth perpetuated by disablism and driven by capitalism. We are all actually interdependent. Chances are, disabled or not, you don't grow your own food. Chances are you didn't build your car, bike, wheelchair, subway, shoes, or bus that transports you. Chances are you didn't construct your home. Chances are you didn't sew your clothing or make the fabric and thread used to sew it. The difference between the needs many disabled people have and the needs of people who are not labelled as disabled is non-disabled people have their dependencies normalised. The world has been built to accommodate certain needs and call the people who need those things independent, while other needs are considered exceptional. Each of us relies on others every day. We all rely on one another for support, resources, and to meet our needs. We are all interdependent. This interdependence is not a weakness, rather is part of our humanity. I love that different perspective. As the recent pandemic has shown us, the support we need can shift and change with the circumstances.
Queer and disabled. Just before we wrap up our moment with you, I think we should talk about intersection of queerness and disability.
Queer is an umbrella term for people who are lesbian, gay, bisexual, pansexual, or who are trans or gender diverse. When it comes to sex and reproductive healthcare, there are many people who assume disabled people are straight and cisgender. Cisgender being identifying as the gender you were assigned at birth.
Obviously, that's impossible. It's like saying all disabled people are white.
But while we know this assumption is offensive, it also acts as a barrier to healthcare.
If you assume a disabled woman isn't having sex, then you might not screen them for cervical cancer or offer a pregnancy or STI test.
If you assume queer women are only having sex with other women, you might miss screening them for cervical cancer or offering them a pregnancy or STI test. Side note, it's a myth that lesbians don't need cervical screening. HPV doesn't care who you sleep with. Everyone with a cervix needs to be screened.
And what we know are these three things. There are high rates of disability or long-term illness in the LGBTI community.
Trans men and women reported higher rates of disability.
The screening rates for STIs and cervical cancer in queer women and women with disabilities is very low.
So it's important to remember to be intersectional when it comes to sexual and reproductive health for women with disabilities. Acknowledge the difference in their life experiences and don't assume that you understand their experience.
As a professional, your job is to work in collaboration with women with a disability and acknowledge they are experts in their own experience. I live with my disability every day. It's my body, my choice. Let's work together on finding what's best for me.
To learn more about queerness and disability, we recommend watching this brilliant video starring Jax Jackie Brown, a disability activist and writer from Melbourne. They talk about their not so great sex ed, disability, queerness, and how it shaped their relationships and life expectations. Spoiler alert, it's amazing.
Thanks for watching.
And we'll see you next time.